So today I've been asked by Dr. Shaheen almost 6 months ago. She requested me to talk on this topic. It's a challenging topic because even in the talk you will find that we as obstetricians and gynecologists, even doctors, we don't talk about the environment, the pollution, climate change very much. And the main reason is we don't know much about it and we don't feel confident about it. So what is the environment? I think you all know what is the environment, but these are some key facts which we all need to know. It is one of the greatest, the air pollution is one of the greatest environmental risk to health. By reducing air pollution levels, countries can reduce the burden of disease from stroke, heart disease, lung cancer, chronic and acute respiratory diseases, including asthma. And Professor Sirajuddaulah has very nicely explained the epigenetics and the dangers faced to reproduction as well. So in 2019, 99% of the world's population was living in places where the WHO air quality guidelines levels are not met. The combined effect of ambient air pollution and household air pollution are associated with 6.7 million premature deaths annually. Outdoor air pollution is estimated to have caused 4.2 million premature deaths worldwide. Some 89% of those premature deaths occurred in low and middle income countries like Pakistan in South Asia. Policies and investments supporting cleaner transport, energy efficient homes, power generation, industry, and better municipal waste management would reduce key sources of outdoor pollution. Access to clean household energy would also greatly reduce ambient air pollution in some regions. So I think living in Karachi and Pakistan, at least we are aware of the extent of pollution. Or are we not? I don't think we're not. If you look at this map, this is the subcontinent, and look at the air quality. In the green, it's 0 to 50, which is good. And as the colors get darker, the brown is 301 to 500. That's the index, air quality index, that is hazardous. And before that is very unhealthy. And look at what we are like in the subcontinent. Look at this region. So Karachi, most of India, Bangladesh, we're very much in the unhealthy and hazardous classification. And as you know, yesterday we experienced increased rains in Karachi, and these are the effects of excessive water and rain, the diseases, the hazards, accidents, etc. And then too much heat has its own effects, malnutrition, etc., etc. So the types of pollution that we are afflicted with: air pollution, soil pollution, and we can see plenty of evidence of that, including waste disposal, burning of waste, toxic chemicals, insecticides, noise pollution, which affects our hearing and general health as well, and water pollution, toxic waste being dumped in the sea, in the rivers. Our rivers are polluted, and drinking water, safe drinking water, is becoming more and more scarce. And it is a shame because we are a country which should be very, very rich in which we are rich in water. We have glaciers, we have 5 rivers, and we don't have enough dams, we don't have water conservation policies. So environmental pollution can fundamentally affect reproduction. It alters the production or efficacy of sex hormones. There are chemical pollutants which can interact with sex hormone receptors directly or indirectly, altering blood levels of sex steroids and disrupt sexual function. Reduction in androgen levels impaired spermatogenesis, morphological damage to reproductive organs, and decreased sperm quality, leading to reduced fertility and population decline. This is a worldwide trend which we are all seeing. And these are the effects on reproduction, which, the source can be the food that we're eating, contaminants in the air, in the environment, and endocrine disrupting chemicals. Now, how many of you are aware of these endocrine disrupting chemicals? Did you hear that word before? Yes, so I think many people who are working in IVF or infertility are aware of it. In fact, patients are often counseled on avoiding these, but these are all around us and we are using them ourselves. So I can't go into the details of it because of time limitation, but this is something we as doctors, as practicing clinicians, as not just gynecologists, but every doctor needs to know this. Gynecologists do not discuss reproductive health and the environment with patients. So we tend to avoid the topic. Pharmaceuticals and potential toxins are released in the environment. There's occupational exposure. So many people don't know, like hairdressers or women working in beauty parlors are exposed to these toxic, potentially harmful chemicals, which can not just affect their own fertility and health, but others as well visiting these places. Easy, accessible resources should be available for practicing gynecologists when faced with potential environmental exposures and general patient health advice. So I won't read this whole thing, but just to let you know that even a first world country like the US, their population seems to be getting sicker. Their life expectancy is decreasing. And a lot of it has to do with carcinogens and toxic chemicals in the environment. Both the general public and clinicians need to be knowledgeable about these exposures. And in Pakistan, these are our concerns. These include deforestation, soil erosion. Those of our colleagues who have worked in the armed forces who go all over Pakistan, or our children of parents who have to travel because of their job, and they see all over Pakistan what is the situation. So there is deforestation. Wildlife populations are threatened because of poaching and urbanization. Coastal degradation from mining activities, increased pollution. We know what is happening to the mangroves in Karachi and the whole coastal belt of Sindh. Those of us who are in Karachi are aware of this, but most people in Pakistan have not even heard what mangroves are. So you need to know about that as well. Freshwater resources are polluted by industrial waste and sewage runoff, improper waste disposal, air pollution. And this is a picture of Lahore. You can see the smog, and you can see our Lahori friends are suffering from this problem. Schools have to close down, etc. So there is increased fetal loss, miscarriage, low birth weight, and preterm delivery associated. Toxic chemicals are associated with birth defects, neurodevelopmental delays, and there are endocrine disruptors. So how many of you are aware of lead in lipstick? We will not give up our lipstick, will we? I'm wearing lipstick. And I have a joke about lipstick, which I used to tell my residents and my trainees, that all of us in this audience, the working women, and I was talking to Rubina the other day, that at a time when I was giving my MRCOG part 2, us waqt sirf do hi parts the, there was a BMJ editorial on women doctors being super women, because that's what we are. Because we are doctors, we are mothers, we are wives, we are and we are the Masis at home as well. And the difference between the Masi at home and the madam at work here is the lipstick. So you put on, that's why I always carry a lipstick in my purse, कि that's my mode change, इधर से उधर ऐसे होता है. So that is the thing, you see. We don't read the labels, but there is lead in any colored thing, okay? Even paints and all that, but makeup that we use, it is loaded with these chemicals. Parabens, fragrance cosmetics, you know, the perfumes we use, एंड आप जो स्किन लोशन भी यूज़ करें उसमें कोई ना कोई हल्की सी स्मेल होती है. ऑल दीज आर पोटेंशियली हार्मफुल थिंग्स. Lead based lipsticks, there is a certain level which is allowed, but I don't even know if that is okay. But most lipsticks, you can't even read the, you know, itna chota print hota hai. It's very hard unless you're going with a magnifying glass. So you can choose, you can be clever about it, and you can choose the kind of lipstick you want and stick to it, and hopefully it would have. So they're potentially neurotoxins. Okay, there's even arsenic in some products, low levels of arsenic. So these are all there in your shampoo, in your soap, toothpaste, so you need to look at the labels. These are dangers in the makeup bag. So what can you do? You can read the labels, avoid the harmful ingredients, opt for natural alternatives if you can find them, seek professional advice. That's easier said than done. Even our fertility experts don't have time to talk to the patient and would like to avoid these conversations because, you know, there's no hard evidence, but we know the growing trend. And, but you can have leaflets. You can have these advisory leaflets in your clinic. So we are imbibing these things not just in the air, but in the food that we are eating, where prescription drugs, in the lifestyle choices that we make. It can be environmental also, the tobacco, the nicotine. We can be passive smokers, and there's second-hand smoking, and there's third-hand smoking. The nicotine and the cigarette smoke, even if you're not smoking or your husband is smoking, it carries in his clothes, in the room that you're sitting. It is imbibed into the furniture, the sofa, etc., and you become a passive smoker. It's there. You can't escape it. So research is lacking. We're not comfortable with the topic. There is no data, sufficient data to support the topic historically. We have more important topics to discuss. We follow the ostrich approach. We hide our heads unless we can give a full and complete answer, like in black and white, or solve the problem. We really are unaware that there is a problem. When we do, we just have not realized it. Blood sugar, hypertension, and similar to the obesity talk just now. So these are all, evidence of, this is in USA, that how much lead there was in the water, and you can see even the color of water. So this was all reported. And this is also has been reported that sperm counts of Western men is going down. Testicular cancer is going up, breast cancer is going up, hypospadias is going up, sperm counts are going down. And we have forgotten history. We've forgotten that diethyl estradiol, stilbestrol in the 1950s led to phocomelia. अब हम वो दवा नहीं यूज़ करते तो भूल गए, वरना it was a textbook picture about 30-40 years ago. This was a harmful substance, and there are many more in the environment. So we have endocrine disruptors of the 21st century, and there's methyl mercury, which can cause all these problems, developmental outcomes. Mercury exposure can be from small fish, and we have plenty of small fish in our ocean, and we consume small fish in our diet as well. But how many of us have had it checked about the mercury level in the fish in our seas and in our rivers? Samples of human hair show mercury. And fish is exported from Pakistan to European and other markets, but if the mercury levels are high, they will be discarded. So I'm just finishing, yeah. So chemicals in the environment, there's synthetic chemicals, and endocrine disruptors by definition are chemicals that may interfere with the body's endocrine system and produce adverse developmental, reproductive, neurological, and immune effects in both humans and wildlife. Don't forget the microplastics. Please do not cook or heat food or reheat food in plastic, please. And I'm just going to read the headings. You need to read up, do your own reading. Microplastics are creating havoc in our environment and to our health, not just the fish in the oceans. The phthalates are also disruptors which are present in fragrance products, which we are all using. Bisphenol A, dioxins is a carcinogen, very commonly found, and pesticides, which are being used in agriculture. So we are all being affected by these, okay? The clinicians, when you ask them, this is a survey, this is what the clinicians said about their environmental exposure. Look at it: smoking, alcohol, diet, etc., violence, pets, seatbelt use. These are all preventive measures. Doctors know this is bad for them, yet they are exposed to it. But when it comes to environmental disruptors, very few know. So there are guidelines and suggestions out there from the American College as well as FIGO, and what kind of food we must be eating, what kind of advice we can give to pregnant women, what to avoid, mercury, bisphenol, etc. So we must have a list to tell our patients. And these are all the list of toxins which must be avoided by pregnant women. So obstetricians can take a leadership role where actually every obstetrician and gynecologist is a leader. You may not realize this, but you are. Your patients who belong to the community trust you. They come to you, then they bring their daughter, and then their granddaughter. They all become, you end up treating several generations. And what you say matters to them. They trust you. रिश्ते भी करने से पहले आपके पास आते हैं, isn't it? कि जी हम सही करेंगे. So we can address the problem, and this can affect the preterm birth, low birth weight, stillbirth, effects on brain development, and we can talk to our representatives. It would be nice, just like we have a list of drugs to avoid in pregnancy or caution, we should also have a list of people, or women or men. Don't forget the men, please. We have, I don't know what SIRM is, whether they see this, but we have an increasing number of men with low sperm counts who are coming from the area of, Balochistan, the Chagi mountain area. And somebody needs to do this research. So there are lots of committee opinions, but how we can help is support our ministers of health for environmental issues, talk more and more about it, give talks about it, and advocate for policies to prevent exposure to toxic environmental chemicals. That's the first thing. Work to ensure a healthy food system for all, make environmental health part of health care, and champion environmental justice. These are some of the links you can go to, and in your own office, you can do something like this. You can make your environment more green, even in your hospital and clinic. Try and put more green plants to make it a happy place. I've tried to do this with my own, and I'm very happy to share. My friend Rubina is sitting there, and this is a very nice, which says Bismillahir Rahmanir Rahim. So Allah's blessings, the plants giving us blessings too. Thank you very much.